Hey there. Today we're diving into a topic I've never discussed on the show before, which is GLP-1 medications for children. These medications are getting a lot of attention. You may have been hearing about them. You might be confused about them. You might be alarmed about them. Today I'm diving in with Dr. Chrissy Ott, who is a pediatric obesity medicine expert, to discuss GLP-1 medications for children, the pros, the cons, the watch outs, so that you have a better understanding of these medications. The goal of the show today is not to promote them nor to dismiss them, but to have a better understanding of what these medications can do for children and how they can be used as a tool. We have a very interesting conversation ahead of us. Dr. Chrissy Ott is a dual board certified internist and pediatrician. She works with children who struggle with the health conditions associated with excess body fat. And I think you'll really enjoy this snippet of our conversation. If you want to hear the full conversation, please go to the podcast, the Nourished Child podcast, where you can hear the full audio of this conversation, and you can find that anywhere where you listen to podcasts.
You mentioned GLP-1s as a tool, and can you, for the listeners out there, talk about who might be a good candidate, like as you are thinking this through from a pediatrician standpoint? Now I'm asking you to put your pediatrician hat back on. Who's a good candidate for the medication, and how do you think that through as a pediatrician? How do you come to that decision?
Yeah, that's a great question. One of my wishes is for more general pediatricians to get more exposure to weight medications, to their pros, their cons, their adverse effects, so that they're not prescribed necessarily always and only in high intensity, weight management programs. But the who, first of all, I think, children who have had elevated BMIs over time, for whom lifestyle intervention alone seems inadequate. And sometimes people will say has failed, but I am going to say the words has been inadequate because I think that's a distinction worth making. When we think about healthy lifestyle interventions, that's for everyone, reducing the amount of processed food in our diet and getting adequate movement in our lives is for everyone, regardless of body size or fat accumulation. And it has felt in my family like none of that was ever going to be enough to counterbalance the momentum that I saw in my child's physiologic makeup. And so we kind of were on this hamster wheel of, it was just like a downward spiral. Like we can't do this because we can't do that. And it's not enough. And yet we don't have the other thing to do. And the specialists are tied up for a year and you can't get in to see them. And so I just felt like I'm not doing nothing is actually being complicit with further harm. And I realized one day last year, I was like, this is not just like a behavioral situation. It's not just about my kid and hyperphagia. It's my kid has a metabolic or a medical condition. It's how she's made. And it requires a medical or metabolic intervention, not just a dietary intervention, not just anything. It's really just like so very complex. We need all the parts. So when I realized that, I began to think about using tools. And I want to say that before we go to GLP-1s, there are other medications that are absolutely helpful and effective in the same vein, including phentermine and Contrave, which these are medications that can be used also to medically help regulate appetite, so that we get more into a more intuitive eating realm as opposed to hyperphagia or food avoidance. Right? We're not trying to go all the way to food avoidance. We just want to regulate an appetite. So kids who have been in the high BMI range for some time for whom lifestyle interventions are inadequate, and also who are on board themselves with getting treatment. So I think it's really important to have their assent, even though we don't talk about consent. When I asked my child if she would be interested in seeing a weight management doctor, she kind of jumped out of her skin with a yes. And despite being very averse to injectable vaccines all of her life, was like, yes, I would even take a shot if I thought that it would help. Sadly, like many kids in larger bodies, she has received some undesirable social feedback and exclusion that we cannot help but attach to the fact that she's in a larger body than most all of her friends. And it's really, really painful. And I am against that in all the ways.
Yes.
But it's part of what drives her to want a different experience of her body.
I think the social pressures are global.
Yeah.
Based on my experience with my patients, it's a global occurrence and definitely a motivator for a lot of families to take action, whether it's medication or getting more serious about positive lifestyle behaviors.
Yes.
Who is not a good candidate for these medications?
Well, the medical contraindication is anybody with a history in their family of thyroid cancer. So, in particular, there is a familial syndrome called multiple endocrine immune syndromes. So, anybody with thyroid cancer is a big no. Some people who have had a history of pancreatitis are a no. That's something to be considered, I think, on an individual basis. But importantly, people who are just slightly out of range with their BMI, or people who are looking to like refine their bodies, if there is more of a small change needed, that's not an appropriate medication. So anybody who's vulnerable to eating disorders that are restrictive, this would be a very terrible tool to use.
One of the things that listeners might react or say is that every child is vulnerable to an eating disorder. What would you say to that?
Yeah, my compassion is moved by that. I don't disagree. I think anybody could be vulnerable to an eating disorder, and yet there will be cases where it seems like this is still a healthy thing to do for a particular child, while giving guardrails, while looking out for any kind of slip into restrictive behaviors. I'll tell you that in my own household, my daughter is well aware of my own restrictive, remote restrictive eating past. And if I get an inkling of any kind of restrictive, anything, like, we are talking about it. We're talking about it right away. We're like, no, that's not going to fly.
Yeah.
We are going to eat our lunches. Yes. Like, this is not how we're going to have an experience of weight loss, my love. Let's not go there. But it's not a straight line, and there's no guarantees that you're going to stay out of the margins,
Right. How do you find that children and teens who are on these medications literally might not have an appetite to eat, right? They might have that very reduced appetite throughout the day. And one of the concerns I know is this idea of kids are growing, they're still developing. How are they going to get adequate nutrition and meet their nutrient needs when they have no appetite?
And how are they going to avoid losing lean body mass? One of the criticisms of GLP-1s in adults is that too much of the weight lost can be muscle mass. And our provider started us working with a trainer early on, and I think that we still have a long way to go in terms of optimizing that, but paying attention to protein, paying attention to fiber, paying attention to high nutrient foods. And I think that having a multivitamin, I'm a fan of that as a pediatrician in general. I think it makes sense to shore up our micronutrients. And that is a position that not everybody will agree with, and that's okay. But it's my position. So yeah, when it comes to a child whose appetite has been suppressed by medication on purpose, we have to be very sensitive to sensing when are we dipping into not enough nutrients and when are we just into, okay, we're back out of hyperphagia and into a healthy intuitive eating. You know, in our family, that's where we ended up. And if it went further, then I would probably ask our provider about reducing dose, because I do think that medical starvation is not the goal.
That's it for today, folks. I hope that you got some value out of this video snippet from the Nourished Child podcast. Dr. Chrissy Ott came on to discuss the pros and cons and what we can take away from the use or the reality that GLP-1 medications are being used in children and teens. And I hope you left with some clarity about this topic. Remember, you don't have to make a choice between taking GLP-1s or not taking GLP-1s for your child. You don't have to make a choice between their health and their well-being. You can focus on both. If this episode was helpful, please pass it on to another parent who might want to hear about it. And remember, I appreciate all of your listening of this podcast. Go rate, like, review the show if you feel so compelled. Thanks for listening. And until next time, be sure to give that child in your life a loving squeeze today. Bye for now.
Thanks for listening to the Nourished Child podcast, where the #1 goal is to help you grow a nourished child inside and out.